Hi, Dr. Pelto here. I have a patient and she has been dealing with interdigital neuromas for a number of years, and we used this treatment right here, which is called focus shockwave, and we treated the area of the nerves, and it had some interesting results. Now we're on shockwave number 3, so I'm just gonna have you tell me kind of your background with your neuromas and how the shockwave helped.
Sure. So I've had these neuromas for 3+ years. I have 2 of them on my right foot. They've been a pain level of 8 or higher most days on my day-to-day activities. And when I came in here for my first shock treatment, it cleared up. When I walked out, there was no pain in my right foot, and I thought, maybe it's just numb for a while. Let's wait and see. And I came back for the second treatment, and my pain level was at 0. It's still at 0. I'm finishing the full 6 treatments just to make sure the nerves calm down. But the only time that I have any pain in either of my neuromas, is if there's only direct pressure applied or when we're doing the shock treatment.
And before you tried cortisone injections, and then you were offered surgery, right?
Correct, yeah. When I lived where I was previously in another state, I did 2 cortisone injections, which were very painful, and they neither lasted longer than 5 weeks. And they had offered surgery once they got to a larger section or a larger size, and said that it would probably have minimal results because I had 2.
Yeah, and so this is the device, and what I think is unique about this, it's called a focused shockwave. We have a radial machine. I don't think it works as well if you're talking to your doctor about it. Radial machines, I think it has too much impact. The shock, it's electrical, and I can go very, very low. Unlike plantar fasciitis, you want to get to a higher level with the focus shockwave. You're going to go very low in terms of energy. And basically, if you put it on your hand, you're not going to feel anything, but on the foot, you're going to feel it, and it's going to calm down the inflammation around the nerve because the nerve is so sensitive. That's why we use this type of machine.